Why I spend so much time teaching and mentoring is because the earlier you can diagnose it, the better the outcome. So in a child where you notice it right away, the first thing I tell people to do when the child is having a flare of symptoms medically is to give ibuprofen. 10 milligrams per kilogram, because if that decreases the severity, intensity, or frequency of the flare, that intensity of the psychiatric symptoms that we're seeing, or the urinary symptoms, or the sleep symptoms, that tells you that there's an immune or inflammatory component to it. So that's something very simple, but it does need to be an effective dose, which is 10 milligrams per kilogram. So for a 40-pound kid, that's 200 milligrams. So that's number one. Number two.
And how long would you take that dose?
If they do it once and they see it happen, then they should try to find a medical professional that can further treat
It's almost
that.
like a
diagnostic trial.
Exactly.
Right.
Okay.
Yeah. And then you could use it therapeutically. Like, most people are not going to get in the next day to see somebody. And unfortunately for somebody like me, it may be 2 years. So don't wait to see me. But you can continue it, twice a day for a couple of weeks if you need to, while you're waiting to find somebody that can help figure out what the underlying problem may be. Then what I recommend doing is figuring out diagnostically, did this happen after COVID in the family? Did this happen, like I said, after mycoplasma? Or could it have been strep? And because the strep especially can be diagnosed by a throat culture, if it is an abrupt onset, get that and treat it with an antibiotic. But then the other thing, in addition to treating the symptoms, either with an SSRI at low dose therapy, is also there are several other things nutraceutically that I find very helpful. For instance, turmeric is a wonderful spice, but it's also a very good anti-inflammatory, and there's good research that it helps to decrease anxiety. So I may use that in a child. There is good research that very low doses of a nutraceutical like lithium orotate may decrease OCD. So I look at what are the biggest symptoms. Nobody in the family is sleeping. Well, then I want to give something to help everybody sleep, whether it's melatonin or valerian or, a gummy that has not that kind of gummy, but a gummy that has theanine. And I was getting there. Anyway, get everybody sleeping. If the child has tics, one of the best interventions for tics is magnesium. There's great research on that. If it's OCD and anxiety, it may be N-acetylcysteine. There's 17 studies that show that it decreases that. So in children, I at least try to use some of these nutraceuticals to see if I can decrease the symptoms while we're also pursuing therapy, while we're also getting some blood work or trialing an antimicrobial, et cetera.